Today we will discuss pain pathway and the Brown-Sequard syndrome. Okay, now pain pathway, it has got three factors, that MTP, that is the modulation, transmission and perception. First come to transmission, how it runs. The pain, and first we have to make, and this is the cut section of cerebral hemisphere, this is midbrain, this is pons, midlobe oblongata, and this is a spinal cord. And now we all know, and this is the sections of the spinal cord, this is central canal, this is posterior funiculus, lateral funiculus, anterior funiculus, anterior horn, posterior horn. Now, and this is our dorsal root ganglia, this is ventral root forming a spinal nerve, this is dorsal rami, this is ventral rami. Now lateral spinothalamic tract, the first order neuron enter from the dorsal as well as the ventral rami, from the ventral 2/3 of the body, and this is from the dorsal 1/3, and the cell body lies or the first order neuron in the dorsal root ganglia, and it ends up at the posterior horn in the substantia gelatinosa. Then it crosses to opposite side, the lateral spinothalamic tract, carrying the pain and temperature sensation. Okay, now it is crossing to opposite side in the lateral funiculus. This is the side of the lateral spinothalamic tract, but it ascend 1 to 2 segment above. This ascend is not like this, that is crossing and ascending. This is an oblique course, and it takes 1 to 2 segment to travel. Okay, now it is crossing to opposite side, and now it is ascending lateral spinothalamic tract. It, along with the anterior spinothalamic tract and the spinotectal, form the spinal lemniscus in the upper spinal cord. Okay, now it is coming to the PPL nucleus of the thalamus. Here is the site of thalamus. This is thalamus. This is PPL nucleus of the thalamus. Here the second order neuron ends. Now third order neuron from the posterior limb of the internal capsule going to the postcentral gyrus. This is the postcentral gyrus, the sensory area. MS Dhoni, motor and sensory. Precentral is the motor, postcentral is the sensory. So it ends up here, the third order neuron, and it is carrying the pain and temperature sensation. So this is the transmission. Now come to the perception. Perception depends upon the two factors, that the slow pain and the fast pain. Slow pain and the fast pain. Fast pain is traveled by A delta fiber, where the slow pain is carried by the C fiber. It is highly myelinated. It is poorly myelinated tract. Poorly myelinated. It is very accurate, very efficacious, and very fast, and it is dull, slow, okay, and not accurate. The site from where the pain is coming is not judged properly. Okay, now it fast pain, it is felt less than 0.1 second. Okay, and this is more than 1 second it takes to perceive. Okay, now The fast pain, the example is the pricking pain, pin prick, acute pain, okay, and this is the dull pain, dull burning pain, aching pain, visceral pain, which is dull in nature, okay. These are the differences on which the perception depend. And it is the fast pain is coming through the lateral spinothalamic tract, and this slow pain is by the many ways, that is the intralaminar nuclei of the thalamus. Here is the intralaminar nuclei of thalamus by the reticular formation. The reticular formation is giving the bypass channel to the lateral spinothalamic tract. So through this lateral spinothalamic tract and through the reticular formation by various pathway it comes. Okay. Now coming to the modulation, and also this fast slow pain is using at the level of the substantia gelatinosa. Here it is using many interneurons to travel, and this is coming substantia gelatinosa, and then there are three order neuron. There are first order, second order, and three order, but it is using here many interneurons at this level. Okay, that's why it is not so accurate from where the pain is coming. Now come to the modulation. The modulation, it depends upon the gating system and the visceral and the emotional factor or limbic system, depend upon three factors. Now what is gating system? It is the local gating system and from the analgesia system. Okay, the local gating system, that as it is travel by local gating system. Suppose if we are receiving some pain sensation from at one place. Now by the nearby the adjacent area, if we give another stimulus or if we rub the adjacent area, this pain pathway is blocked. Okay, जब तक हम इसके देते रहते हैं, as long as we give this nearby stimulus, this pathway is blocked. So this is called the local gating system. And analgesia system, it is coming from the periaqueductal gray matter. This is the midbrain, and this is the cerebral aqueduct, and by the side of it there is the periaqueductal gray matter, in which from that area, this periaqueductal gray matter, the analgesic system comes, and at the site of nearby the substantia gelatinosa, it releases endorphin and enkephalin, which relieves the pain, as well as from the dorsal raphe nucleus. Dorsal raphe nucleus is the nucleus of the reticular formation. It also gives analgesia over there, but here is the neurotransmitter is the serotonin. Okay, so this is about the gating system. Now coming to the visceral, because many things are associated with the pain, like vomiting or nausea and lacrimation. All these are, if we feel pain, some impulses are going also to the vomiting center, the nausea center, lacrimal center, and these are associated with that pain. And emotional and the limbic factor, that when we are in pain, the pain feels more, and when we are happy the pain feel less. if जब हम लोग खुद से गिर जाते हैं तो ज़्यादा दर्द नहीं होता, जब कोई धक्का दे देता है तो बहुत दर्द होता है. तो this depends upon the as the pain also travels to the cingulate gyrus. And here is the action that is all this, the pain sensation also going to the insula, from where this associated features along with the pain is felt. Okay, and here the pain pathway also going to the cingulate gyrus, which governs the Papez circuit, and through which the emotional factor is also attached with the pain pathway. So this is all about the pain pathway. Now coming to the Brown-Sequard syndrome. In the Brown-Sequard syndrome,